Hey guys, in this video, let's see about pulse. First, coming to the definition, what is pulse? A pulse is a waveform that is felt by the finger, produced by cardiac systole, which traverses the arterial artery in a peripheral direction at a rate much faster than that of the blood column. A pulse is commonly assessed in the following ways: rate, rhythm, volume, character, whether felt in all peripheral vessels, radiofemoral delay, condition of the vessel wall. Then coming to the pulse rate. Pulse rate should be counted for 1 full minute by palpating the radial artery. Normal pulse rate is around 60 to 100 per minute. If the pulse rate is less than 60 per minute, it is called sinus bradycardia. If the pulse rate is greater than 100 per minute, it is called sinus tachycardia. Before going into other pulse forms, let's see how a normal pulse will be. You can see a dichrotic notch there. It's a pictorial representation. Then coming to the hyperkinetic pulse. It's a small weak pulse with a small volume and narrow pulse pressure. The causes may be cardiac failure, shock, mitral stenosis, aortic stenosis. You can see in the curve the hyperkinetic pulse with a small volume and a narrow pulse pressure. Then coming to anacrotic pulse or parvus et tordus. It's a low amplitude pulse with a slow rising and late peak. It's seen in severe aortic stenosis. Then coming to hyperkinetic pulse. It's a high amplitude pulse with a rapid rise, large volume and wide pulse pressure. The causes are it's seen in high output states like anemia, pyrexia, beriberi, also seen in mitral regurgitation and ventricular septal defects. Then coming to collapsing pulse. It's a large volume pulse with a rapid upstroke and a rapid downstroke. The causes are patent ductus arteriosus, arteriovenous fistula, aortic regurgitation, and rupture of sinusa valsalva. Pulsus bispheriens is a single pulse wave with two peaks in systole. This is best felt in brachial and femoral artery. The causes are aortic stenosis and regurgitation, hypertrophic obstructive cardiomyopathy, and seen in dissection of aorta. Then coming to pulsus dicroticus. It's a single pulse wave with one peak in systole and one peak in diastole. The causes are left ventricular failure, typhoid fever, dehydration, dilated cardiomyopathy, and cardiac tamponade. Then coming to pulsus alternans. Alternating small and large volume pulse in regular rhythm. It's a sign of severe left ventricular dysfunction. Then coming to pulsus paradoxus. It is an exaggerated reduction in the strength of arterial pulse during normal inspiration or an exaggerated inspiratory fall in systolic pressure of more than 10 mmHg during quiet breathing. The causes are cardiac tamponade, constrictive pericarditis, airway obstruction seen in acute severe asthma, and superior vena cava obstruction. Thank you guys. Hope you guys understood about pulse. If you have any suggestion, please do comment in the comment section. If you haven't subscribed my channel yet, please do subscribe.